quantify healthcare costs is that there haven't been a lot of options with regards to trying to zero in on an individual or a couple's costs. There's been great research, great data, great macro information available from which a financial professional can take a look at the data, understand who their clients are, and then massage the data to meet their clients' needs. For example, a couple who may be in better health versus a couple not in as good health, or an individual, and so on, and trying to understand how long to plan for and what are the costs associated with having better health and or not as good. So ultimately, there was a lot of give and take and play in that. The good news is we have partnered with Milliman and Associates. They are a leading actuarial firm, global organization, largest U.S.-based, with regards to capturing healthcare data and working with our other partner, the third leg in the stool, Healthy Services, who for lack of a better term, they are the IT firm, or the firm of doctors and marketing folks who were able to harness the information and build a product, a tool that will allow a financial professional to help you drill down to determine your healthcare costs in the future. And there are three areas, three basic areas that Milliman is going to ask for information to make this personalized about you. The first area is where you live. I think we all know that healthcare costs will vary by state, and obviously as well in some of the larger states, intrastate as well. So where we live and who we are, our gender, our age, can play into our healthcare costs as well. Secondly, it's our health history. And if you think about it, if you will roll reverse with me for a moment, if you were my financial advisor and you were trying to quantify my potential future healthcare costs, you'd want to know about my health history, because that will have an impact on my future healthcare costs, the types of services I will need, and more importantly, and where a lot of our out-of-pocket costs come from, what types of prescriptions will I need to treat my conditions? And so that's the second leg of this three-legged stool. And the third one is how much you earn in retirement, because Medicare is means-based. Medicare premiums, and we'll talk about the parts, Medicare premiums for Parts B and Part D are predicated upon our modified adjusted gross income. And that is certainly a number that doesn't necessarily remain static, so as that number may move in retirement, if it moves as categorically up or down, so then can our premium costs for Medicare and retirement change. And we'll discuss that as well. So let me do this as I jump into the presentation. Let me start with this end in mind. I am going to end with showing you the fact finder that is designed to capture that data. This presentation is going to be educational, but more importantly, the team I represent from Nationwide, the Nationwide Retirement Institute, our goal is to do more than educate. While we want to put you in a better position to make an educated decision, the key then is having the resources from which to make that decision. And at the end of the day, we're going to show you how you can by generating a report from your personal information, you could put yourself in a better position to understand what types of resources you'll need to have set aside to meet your healthcare costs. So that's what this is all about. We'll get into the presentation now. And let's get back there. There we go. I will not talk about any products tonight. Primarily, this slide is just referring to the fact that we're looking at data that's historical, and I will remind everyone, like any part of a financial plan, if you do choose to run a report, as any of the material things in your retirement lifetime change, if your health improves, if you are earning more or less, if you have a change in life and so on, where it's going to be material, well then you'll want to run this again along the way. So the presentation is broken down into three areas. The Retirement Income Challenge, we'll take a look at Medicare and the parts, and I'll finish with helping you understand how you can take this information and turn it into a good decision-making process for you. So with that in mind, we'll start with the challenge. A lot of folks I talk to, as we discuss retirement, the two the two biggest conversations that come up are healthcare costs and our Social Security. And on this slide, you'll see that along the road to retirement, there are a lot of different points in time where we can make a decision that will impact where we're taking money from and or when we can take money. There is one on here, though, that is a little bit different, and that is age 65 Medicare benefit eligibility. What that tells us is we are now eligible for enrolling in our government-provided health care in retirement, and at that point, the question is, what resources will we use to cover those costs? Now, some of you, as you may have done your own research on health care and Medicare, you hear all the time that 10,000 baby boomers are turning 65 every day. That's the opportunity in front of us. I like to reposition that and say, at some point in time, you know, with good health, all of us will have an opportunity at some point to make that decision. So I change this as I'm talking to financial advisors by day to be able to talk to their clients by night, and that is every day 10,000 baby boomers are turning Medicare eligible, and they'd like to know more about Medicare, and that's really what the balance of this presentation is going to be about. So as I bring up this slide and we look at this Venn diagram, this is about as close to any type of investment information I will address in the entire presentation. What I need everyone to remember in looking at this, the takeaway here, is that when we retire, we're not retiring on our assets. We are retiring on the income our assets generate. And depending on how you position your assets, it will impact how much income you're going to have. The one thing we need to all remember is that unless we're independently wealthy, then we're going to need to continue to have our assets grow in retirement, because we all know that healthcare costs, amongst other costs, won't be less expensive 5, 10, 15, 20 years down the road. So the challenge with this, though, is as we get closer to retirement, into and through retirement, we become concerned about what the market might do to our money on the downside. So the idea then is to take what we've been very good at, and that is allocating our assets to mitigate risk, spreading the risk out, and also consider diversifying our portfolio by different products to help to protect the assets so the income will be there when we need income for things like healthcare, and the list goes on and on. So the challenge to all of us as we're closer to retirement is to realize there are two markets that we have to be concerned with: the investment market and the marketplace. And if we allow our portfolio to be positioned properly, we can participate in one and equally participate in the other. And it's that marketplace where inflation's working against us that requires us to at least understand, each of us individually, what our allocation will look like to make sure that the market can work for us. And so the principles that work to get us here are the same principles that work to get us through as well. What are some of the things we need to also appreciate? That is, while we're working when the market's down and prices are up, while we're still working and contributing to our retirement plans, hopefully we understand that if the market's down and our money's going in on a monthly basis, we're accumulating, we're purchasing more shares, and the hope is the more shares we have in retirement, if the market's higher down the road, the more valuable it's going to be to us. And while those quarterly statements don't look so good, we really haven't locked in any losses. So it could be aggravating at the end of March and at the end of June and September and December as we look at our quarterly statements. But what's aggravating while we're still working can really be devastating in retirement if our portfolio is not designed to help offset market loss and inflation. And a good financial professional will be able to help you through good strategies, as we talked about already, to build a portfolio designed to make sure that you do not outlive your assets. If you're married, and that you will have the resources you need to provide adequate income for a surviving spouse, and for the balance of the presentation, the context of being able to meet your ever-growing healthcare costs along the way. So that being said, put the challenge aside, let's talk about the dilemma. There are a couple things that we need to know as well. If I could take a poll of hands, I think we'd all realize and agree that managing the cost of healthcare is pretty complex, and it's likely to be one of our greatest expenses. And in all of the studies, and in fact in one of our studies in 2014, we found that healthcare continues to be that a top concern of both retirees and pre-retirees 50 years old and older. So we want to be able to address all those things What we need to understand historically is that healthcare has run at a higher inflation rate than inflation in of itself over the past 10 years. And I don't like the way this slide is worded, and I'm going to reposition it for you. What this says is if we don't get it right, we may have to change how we're going to spend our money by changing what we were going to spend it on to what we are spending it on. And maybe most of us on this call, if not all of us, wouldn't have to borrow money from somebody else. But if you're giving back to your community, if you're giving back to your alma mater, if you're giving back, if you're trying to put grandkids through college, if you're donating anonymously to a cause that's important to you, if you're doing those things while you're working and would like to continue doing those things while you're retired, if healthcare costs are so meaningful and we have not taken the steps to prepare for them properly or adequately, we may wind up borrowing from some of those things we'd like to do for someone else to pay for some of the things that we have to do, things like healthcare. So from the onset, our goal is to help you reach all of your goals and to help you understand we know those things are important to you. So getting your healthcare costs right as early as you can and at any stage along the way will help make sure that you're on the path to doing the things you'd like to do for yourself and want to do for others. Now, there are a lot of data points on this slide, but again, we're talking about the dilemmas, and one of the dilemmas we're all facing is that fewer and fewer people in the private sector are going to retire with healthcare benefits. I was in the public sector today, and things are different, especially where it depends upon where I live as well in the Hampton Roads area of Virginia, from Virginia Beach all the way up through D.C. and Maryland. A lot of you and maybe your spouses may be government workers, may have had a military career, and so on and so on. So what we need to understand is that there may be other options available. For the average person in the private sector, fewer and fewer are retiring with health care benefits. And this is very similar to what happened to the pension world when ERISA was enacted, and it opened the door for a defined contribution world, things like 401ks and money purchase plans and profit sharing plans. The burden was shifted from the employer to the employee, and it's primarily employee dollars now going into retirement. The same thing is happening. Fewer and fewer people are retiring with health care benefits, which means it's the individual's dollars. That burden is being shifted to the individual. And that's why nationwide, and seeing this trend and trying to anticipate the needs of the advisor and helping the individual, that's why we spent time about 5 years or so ago starting this process and enrolled this a little over 4 years ago, and we've been very successful in getting in front of people and helping people make better decisions because of it. Well, again, with the dilemma, another nationwide survey, this one goes back to last year, 2015, and we asked over 1,200, almost 1,300 adults 50 years and older to tell us what they thought their health care costs were going to be at age 65 when they were enrolling in Medicare. And as you'll see as I build this slide out, that there is a wide disbursement of guesses here along the way. What I will tell you before I bring up the last one is that don't know was not even an option. So what I'm saying to you, what you can infer from this is one or two of these answers may very well be right, and they are, depending on your situation, your health, your income, and so on, which may give this away. Yet the largest group in responding basically threw up their hands, their shoulders, and their eyebrows and said, I just don't know. And what this graphic will tell you is that nearly 7 out of 10 either underestimate or do not know what their health care costs are. So my question, if we were in person tonight, as I walked up to the podium or the front of the room, I would have asked you all, generally speaking, how much income do you think you're going to need in retirement? And most of us, if not all, will come up with a number that we think makes a lot of sense, and it probably is pretty close to what we'd like to have. My second question would be, what percentage of that will go towards your health care costs? And it's this slide that I asked that question. And it's because I know that you're on this call tonight because this is something you want the answer to. And I'm asking the question because we can help you with that. So without any further delay, I want to move forward, and I want to address a couple things at a high level on Medicare, and then we'll take a look at some of the details along the way. So the first myth, I learned this watching my parents get closer to retirement. My parents believed that Medicare will cover most, if not all, of their expenses. Now, if we extracted the word expenses and we replace it with the word medical needs, that would be correct. But when we're looking at the actual cost of Medicare, the average retiree should expect that they're going to be responsible for about a third or so of those costs out of pocket. Then the question again is, what will those costs be? And our job is to help you understand that. The second one, in my estimation, my experience tells me this is the most important one, and that is a lot of people believe Medicare is going to cover their long-term care if they need it. And in actuality, Medicare does not cover long-term care. Now, there's a reason that that myth is perpetuated, and it's pretty intuitively correct, but factually it's incorrect. And I'm going to spend a couple of minutes on that in a couple of slides from now to help you understand why. And even if it's not something that you need to know today, it'll help you begin to make decisions about how you can plan for the future, but more importantly, for those of you with parents who are retired, getting close to retirement age, siblings, good friends, co-workers, and so on, who may anticipate that Medicare covers long-term care, you can potentially be an invaluable resource to them and helping them understand that that is a myth, it is a fallacy. And we'll talk again about how we can better explain why people think it is, but more importantly, why it's not. So let's go back into the past for a few moments. And what this slide tells us is that depending on the studies that you look at, historically, a financial advisor would take data like this: out-of-pocket healthcare estimates, lower left-hand corner, for a 65-year-old couple can range anywhere from about $250,000 to almost $400,000. Now, perspective, that's two people over the duration of their retirement from age 65 until they pass. And so as you think about it and you do some math and divide that by the number of years someone may live in retirement, you can see what that tends to break down to. But again, role reverse with me for a moment. You're the financial professional. Which number do you use? Well, it takes some good homework and good qualitative knowledge of your clients, and it allows you to make a good educated decision. Our goal, though, is to get away from these rings around the target and get everybody closer to that red bullseye with better information, so that we can boil it down to more specifics. The balance of this slide is reflective of, as you are incurring your 1/3 of out-of-pocket costs, where might those costs be going? Would it be premiums for your Part B and your Part D? Will it be for what Part D doesn't cover, 23% towards prescription drug expenses? Would it be towards your cost-sharing provisions, which is what A and B don't cover? Now, what I want to mention here is that the data driving this pie chart does not reflect an Advantage plan or a supplemental plan, so it's more high level prior to someone owning coverage that covers what their coverage doesn't cover. And you've got to practice that one about 5 or 10 times before you want to share that. But the coverage that provides coverage for the coverage that doesn't get covered. So anyway, that being said, again, bigger picture, this is how we used to do it. Going forward, we'll take a look at how we can help you break down those numbers today more specifically about you. But again, with that as a backdrop, what are some of the challenges? What are some of the myths? What are some of the things that we really need to understand with that healthcare dilemma? Let's now start moving into some positive territory and start talking about Medicare before we move into what can we do about it. So again, knowing we had a pretty broad audience, both live tonight and those who will be listening to this out in the future, I want to say hello to everyone again. This presentation is going to allow us to, again, break down the details of Medicare, and then more importantly, break down the costs associated with it all. And what I like to do is, for anyone who may be associated with someone who is career retired, career military, who would be eligible for TRICARE for life, we can work with those folks as well, as their Medicare coverage would be the same at the top with A and B, but they would have other areas that we would not need to quantify, and we can leave those off of the report. But for the balance of us, we're going to have two choices. One is going to be option one, which is buying the original individual parts of Medicare, and the other would be option two, which is buying into the Advantage plans. So let me do this. I'm going to spend just a couple of minutes on the Advantage plans, and the balance of my presentation will be on option one. And why do I do that? The first reason is Advantage plans are locally based. They are county based. So technically, in simplistic form, if you live in one county today and you're enrolled in Medicare in an Advantage plan, and next year, 2 years from now, 5 years from now, you move to a new county, whether it's intrastate or interstate, you can shop for a new Advantage plan, because the Advantage plans are networks of doctors and medical facilities. And so as long as you're willing to stay in that network, and while the network may be geographically constrained to where you live, if it's a regional or a national, if you will, insurance company, if they do have Advantage plans in other areas of the company, you may very well have some type of reciprocity relationship where you may be able to utilize your benefits to the fullest in some of the other areas. So just like an HMO was popular 10, 15, 20 years ago, PPOs, and we're moving more and more into HSA, into high deductible plans, a Medicare Advantage plan is like an HMO or a PPO, where you benefit from lower in-plan costs by using the doctors, the specialists, and seeking your medical attention in those facilities associated with the network, hence the advantage and properly named. The disadvantage would be, at a high level, for those who are traveling, for those enrolled in an Advantage plan where they're now outside of the network. You won't be denied service. You will be responsible for the costs associated with that service over and beyond what that would have cost had you remained in network. So who is this more ideal for? We'll start with the folks who financially are looking for a lower cost alternative, and then we'll move into the folks who don't need to have better control of their health care with regards to who they're seeing or where they're seeing them. Maybe you're not traveling as much. Maybe the doctors participating in the network, the specialists, are folks that you're very content with seeing. But if, in fact, you'd like to have more control, you're more mobile, you're traveling both domestically and internationally, you then may be interested in option one, especially if it means that you're still seeing the same doctors, the same specialists that you were prior to retiring, and having original Medicare option one will allow you to continue to do that, providing that they take Medicare. So we'll set aside the Advantage plans. If you have any questions on that afterwards, I'm glad to address those. But for time purposes, let's move forward and let's discuss option one. And as we do that, I'll remind myself to remind you that as we get into the parts in Part A, I'll talk to you about why people confuse Medicare with long-term care. So I'll take a breath there. Let us all digest that for a moment. And as I advance here, take a look at the slide along the left-hand side and tell me, do you see something on here that someone that you or anyone else like me, before I really spent time delving into my education on Medicare, might confuse with long-term care? And if you looked at the second or the third points on here, skilled facilities, home health care, you'd be right. And here's how the little anecdote goes. My mom, who had a medical issue several years ago, she's doing fine now, went to the hospital. From the hospital, her prognosis said, you're going to a skilled facility and we're going to care for you there, because with that help you should be able to recover, and then once you go home on a limited basis, we'll have someone come into the home and work with you to help rehab you back to where, hopefully, at least as good as where you were before. Well, if that's the case, Medicare is going to cover that while you're hospitalized with some out-of-pocket costs associated with it. Medicare is going to cover that while you're in a skilled facility, and Medicare will cover that while you're home receiving your home health care. Now, there are some limitations on it. You're limited to 100 days of that follow-up care and so on, and we could talk more about that if you have questions. But the bottom line here is this. A lot of people don't necessarily understand, nor do they take the time to understand the difference between skilled care and custodial care. And under the same roof, the same facility, just like when my mom went, one wing, the east wing, was skilled care, and the west wing was custodial care. In her mind, she was in a long-term care facility because that's where they provide long-term care. So she goes home and she talks to her friends who talk to their friends, and it perpetuates the myth that, hey, isn't this great? Medicare covers our long-term care. Now, someone in the know understands the difference, but a lot of times people aren't in the know until they need it, and that's when they realize they don't have the coverage they need for their long-term care. So my hope is that you'll understand it as I break it down this way. The difference between what Medicare covers and doesn't cover is two people may have strokes. They may wind up in the same facility after they're hospitalized. They may wind up in one wing, the east wing, and one wing, the west wing. Their diagnosis may have been the same, but their prognosis may be, Mr. Jones, with physical therapy, you should be able to regain use of your, and fill in the blank, arm, leg, speech therapy, vision, and so on and so on. Mrs. Smith, fortunately, unfortunately, you had a very serious episode. Fortunately, you survived it. You're a fighter. We've got a way to help you learn to live with the condition going forward. The difference is one is short-term, one is long-term. One is acute, one is chronic. One has a prognosis of healing, and one doesn't. So Medicare will provide coverage up to 100 days for that which is short-term acute with the potential for recovery, but not long-term chronic with the need for learning to live with. And so that's an important differentiator. It's important to know how to distinguish those, but as you can see, it becomes real easy for folks to confuse one with the other. So hopefully you find that helpful. If nothing else on this call, maybe that can help you and help someone else along the way. So now it's time for sticker shock. We're car shopping now for Medicare, and here we go. For all of us enrolling in Part A, if we're never hospitalized, we will not have a cost associated with Part A because we are prepaying our Part A premiums today while we're working. And if we've worked for at least 40 quarters and paid in the Medicare for 40 quarters, once we attain age 65 and enroll in Part A, we do not have a Part A premium. Those who attain age 65 but who have not worked or contributed at least 40 quarters, there is a schedule which says you could still enroll in A, but you will have a premium to pay. Now, there are some exceptions. For example, a married couple where one spouse is eligible because they have worked long enough and contributed long enough, but the other either hasn't worked or they haven't contributed enough. If you as a spouse are eligible for a Social Security benefit, which means you're married for at least a year, you, in essence, would also be eligible to enroll in Part A without a premium. Again, there's a lot that goes into this. My hope is that as we move through the presentation and wind down in a little bit, that you realize this really isn't necessarily about becoming an expert in Medicare or healthcare in an hour. It's really, there's a lot to know, but I know now a good place to find it, and I also know from a quantifying standpoint, if I can provide nationwide with the basic data in those three areas, demographics, health history, and earnings, they can provide me with what matters to me, and that's what I need to focus on. So that being said, Part A is going to the hospital, and if we are hospitalized for prolonged periods of time, it could become quite expensive. But the good news is if you do purchase a supplemental plan or a Medigap plan, just a different name for the same thing, it'll cover a lot of these deductibles and copay costs. So we'll come back to those, to the supplemental plans in a few moments, but let's progress through the parts. We talked about C, which are the Advantage plans, and now we're talking about the alternate choices. A, which is hospital, B, which is medical. Again, left-hand side, what this covers, including outpatient services, medical equipment. This is where our calculator makes this about you, the individual, or you, the couple, because your premium can be different than someone else's premium based on how much you earn in retirement. The deductible for Part B is smaller than Part A, and instead of having large per diem copays, there's a 20% copay on the doctor services and outpatient care. And a note here, preventative benefits are provided without out-of-pocket costs to encourage people to go in for their preventative benefits as scheduled along the way. So next slide, if you have a way to take a screenshot, or if you want to take a picture of this, this slide will provide you with the differences in monthly premiums per person for your Part B or medical premiums. And as you'll see here, it's broken down under individuals or those filing joint tax returns. About 80, we're going to say somewhere between 82 and 85% of all individuals or couples in the U.S. will reside in that first category. The question is, why are there two costs there? The premium for the first category in 2015 was $104.90. It remains at $104.90 this year for anyone who was enrolled in Medicare and Social Security last year, because there's a hold harmless clause that says anybody in the first category in a year where there is no cost of living increase for Social Security, you're held harmless. You will not see a cost increase in your Medicare Part B premium. So again, if you were enrolled in Medicare and Social Security in 2015, then you did not see an increase. The increased cost was spread across the other four categories, and within the first category, for those who were not enrolled in Social Security in 2015. Now, what will happen next year if there is a cost of living increase, then what they'll do is they'll reallocate the healthcare increase in costs, and what we have found historically is that higher premium, the $121.80, will come down for a lot of people, and the other premiums spread across the higher income levels can potentially be reduced as well. The other thing to remember here is that, again, if you're in one category one year, but your income changes enough so that you're in another year, you could see a change in your premium. And again, to note, these premiums are per person. So Medicare is not a household-based benefit. If you are married, you and your spouse will enroll in your own Medicare coverage when you're eligible, and you can enroll in different plans independently of one another. Why does this say 2014? Well, let me ask all of you on the call tonight. It's 2016. If you are looking at your tax return and you see that you owe the government a meaningful amount of money, meaning they under withheld, so to speak, will you pay that right away, or will you tend to let that sit until April 15th? If you're going to let it sit till April 15th and you're 65 and you're enrolling in Medicare, well, they're going to look back for your most recent tax return to identify your MAGI. That means for someone in that particular situation, they'll go back and look at 2014. So there could be a 2-year lag. Technically, it's less than 2 years. We're only in the second month of 16. But in any event, even when you retire, if you retire prior to having filed a new return for a previous year, you may very well see a lag in the number they use, which means your premium may be higher or lower than what you expected. I just want to draw your attention to that, so when it happens, you may have one of those aha moments remembering we talked about that tonight. So we're not skipping over C because we covered it already. It's the other option. After you choose not to go with C, your choices are then going to be A, B, D, and supplemental. So D would be prescription. If you remember, prescription is included in the Advantage plans. It's also available under traditional Medicare, where you can buy the plan that makes the most sense for you. And should you like to make a change, open enrollment comes up each year. For example, if something you're taking today is no longer covered on your plan in the future, or if there's something you're taking now mid-year that wasn't part of your anticipated medication needs, and the plan you currently have doesn't cover that, you can always shop around for a new plan that would cover that, because again, the higher costs associated with your prescription costs aren't necessarily your premiums, it's what your plan doesn't cover. So the optimal prescription plan would be the plan that costs you the least but covers the most. And that's where consulting with your pharmacist at your local pharmacy can really help you make a good decision on which Medicare prescription plan makes the most sense for you. All right, so we covered the three basics of Medicare, the A, the B, the D. Now the question is, how can I buy coverage for the coverage that I have and what it doesn't cover, in particular parts A and B. I want to go on record with the fourth point here. The supplemental plans, the Medigap plans, do not cover your out-of-pocket prescription costs. We're on the hook for all those, and those of you with any experience, directly or indirectly, with anyone who has a long list of meds to take in retirement knows that that can become pretty expensive. Anyway, that being said, now you've enrolled in Medicare, you've been on A because you're still working after 65 or your spouse is still working, and now you're no longer covered by that plan, so you enroll in your Part B. Once you've done that, you have a 6-month window to be able to enroll in your supplemental plan with guaranteed insurability. So once you've enrolled in Part B, which you do within 8 months of no longer having coverage if you're 65 or older, and the way to remember that is that B, that capital B, looks somewhat like an 8. Remember, once you no longer have coverage and you enroll in B, you have 8 months to make that choice for B, and once you do, your 6-month clock is running to protect your insurability when it comes to buying your supplemental plan. So 8 months to buy your B. Once you do, 6 months to buy your supplemental. If you do not buy your supplemental in that first 6-month window, you can always apply for it, but now you're going to have to answer the questions that may indicate health issues, and if there are health issues, that you may be subject to higher costs and or some blackout periods for your pre-existing conditions for some time. So again, like everything else, buying it when you can is always a good choice if you have the ability to buy it along the way. So we've covered A, which is our hospital, B, which is our medical, D, which is our prescription, and our Medigap plans. The plans are also lettered. Let's take a look at what it costs today for a 65-year-old to put their Medicare card in their wallet. In this case, we're using Columbus, Ohio costs. That's where Nationwide's home office is based. But we're going to take the average cost for parts A, B, D, and F, and we're going to total it up, and this is before we even use our benefit. So if you recall, if you've worked 40 quarters and prepaid your Medicare, once you enroll in Medicare Part A, you will not have a monthly premium. Then, if you recall, about 82 to 85% of all U.S. citizens enrolled in Medicare will reside in the first category. Thinking back to that slide, if you're a higher income earner, then you'll know your premium will be greater than $104.90, depending on which category you fall into. Part D, general costs for a prescription. If you take a look at the footnote there, based on Kaiser Family Foundation research, about $42 nationally. I've seen those run anywhere from $15 ranging up into the $150 range as well. Again, the most expensive prescription plan is not necessarily one with a high And then, if you take a look at Plan F here, this is Medigap Plan F. It's not a Part F. Plan F is the most popular supplemental plan in the country. It includes coverage internationally in the countries where it's available. Now, you may have to pay for that service if you're overseas, but when you return, there is a reimbursement schedule based on the plan you buy. And so one of the reasons somebody will purchase original Medicare versus a supplemental plan is because they do travel and they would like to have coverage outside of the U.S. So as you run these columns down, we'll take a look at the amounts here. You can see for the individual, if you're 65 years old, enrolled in Medicare, and you're in the average categories, higher income notwithstanding, you need about $4,000. So low point here, $4,000, $8,000 for a couple. What does that come out to based on a monthly basis? You can see here, it's running you about $650, $660 a month just to keep your Medicare cards in your wallet. Then the question is based on your health conditions, what will that add to your costs? And that's where we're going to be able to show you how we can help you figure that out now. So we're coming into the home stretch. When, and I mentioned this earlier, when do you start applying for Medicare? We're first eligible for our Part A at age 65, even if we're enrolled in a plan through work or through a spouse's plan through work. If we have coverage, all we really need is Part A, unless we're working for a company with 20 employees or fewer. Then basically they can require you, or they don't have to provide you health care. If they don't provide health care, Medicare becomes primary. Even if they do, Medicare becomes primary. But again, for the masses, 65, enroll in Part A, you've paid for it, no reason not to, and if you are hospitalized under a company plan and it doesn't cover everything, you can certainly take the balance of those costs and submit them to Medicare to see if, as a coordinated benefit, your Part A would pick up some of those hospitalization costs. So it's always important to know that you can do that. You can apply as early as 3 months prior to your 65th birthday, the month of or 3 months after. And go back to the first bullet point. If you are already enrolled in Social Security or railroad retirement prior to Medicare eligibility, you'll automatically be enrolled in Medicare at age 65. How many of you know that your Part B premium for your Medicare costs, once you are enrolled in Social Security, will come from your Social Security benefit? That's why it's important, prior to making your Social Security decision, to have that conversation with your financial professional, so that as you're talking about healthcare costs, you're talking about them in conjunction with Medicare, with Social Security, and as you're talking about Social Security income, you're talking about it in conjunction with Medicare costs. So, to summarize, enrolling, 65 for Part A. Once you're 65 and no longer covered, you have 8 months for that capital B to enroll in your Part B. Once you've enrolled in Part B, you have 6 months to enroll in your supplemental, and then 3 months for your prescription. For your application process for Part A, the sooner the better, but no sooner than 3 months prior. Where can you find additional information? My favorite website is Medicare.gov. It's intuitive. It's got great search engines on it. It's got a great search engine for helping you winnow down to which supplemental plan makes the most sense for me. It'll ask about what you hold with higher regard, deductibles or copays. Are you looking for domestic only or international? And what it will do is it'll begin eliminating the plans that don't provide the coverage that you want, and it will provide you then within the remaining plans those that make the most sense based on your preferences, and now you can go out and shop for the plan in your area available to you based on that process. So Medicare.gov, very, very helpful. So a lot to digest again. Again, the resources are available to you. We have hard copies of these resources that, if requested, we can get to you as well. Let's take the next 5 minutes or so to walk through how this works, and then we'll take some of your questions along the way. So my questions earlier, how much income would you like to have, or do you think you're going to need, and what percentage will go towards your healthcare costs? Let's start eliminating that guesswork on the second part of my question, and let's take a look at how Nationwide is positioned to help you by taking a look at your personalized cost based on where you live, your health history, and your income. Anybody who takes the 5 minutes or so to fill out the fact finder and to submit it to Nationwide will receive a report, and in this report we'll provide you with a year-by-year analysis in the future or today, if you're 65 or older, of what you could expect your healthcare cost to be based on those three areas. We'll also break it down and provide you with the average annual cost over the duration of your lifetime. You can choose to run with the default life expectancy if you believe your health is average and for your gender and your age that you should live to the average for yourself categorically, or you can override that with a longer life expectancy, or you can shorten it based on what you know about yourself and your family health history and so on. Once you've done that, then it'll create the report to help you understand what your expenses will be, so working backwards we can then help you determine what the present value of what you need to set aside, either in a single payment or a single payment and combination of periodic payments or any combination of the above. So bottom line is we can help you figure out what the present value of those future dollars are going to be. So how would you do that? I will go over this quickly so that if either A, you've got this in front of you today, or B, you request it and have it in the future, you'll know how to fill this out. The first section on the fact finder will be completed by your financial professional. They'll complete this so we know who to send it back to so that they can consult with you and walk you through this. The next three parts are the three parts I've alluded to already. Number one, tell us about you. We need your name, obviously, so we can personalize it, but we need your gender, your current age, when you're going to retire, the state you live in, and your metro region. And we won't go into this tonight, but that is, if you'd like to see a projection of your long-term care costs, this tool is designed to do that for you as well. You do not have to be married to be able to do this because, again, remember, Medicare costs are individual plans, and so we'll run this for any two people. And then, once we've got that, we'll ask you a quick snapshot here of yes or no questions. Without prying too deeply into the details, we're only going to ask you two follow-up questions, and that would be for cardiovascular disease and cancer. And the reason for that is the recency of either of those health conditions will have a meaningful impact, or recency or lack of it, a meaningful impact on the costs associated with treating it. This is not like applying for life insurance. This is really saying, based on my health condition, what is it going to cost to treat today and in the future? Some people will ask, I have high blood pressure, but it's under control with my medication. Yes, correct. But we still need you to check yes on here because we're going to show you the cost of that medication for the duration of your retirement year. So we're not trying to do anything other here than to ascertain the costs associated with these health conditions. And then finally, when it comes to determining costs, and now you know why, just read this a little bit. Annual income in retirement. Select the range that best fits your actual or estimated cost because your MAGI is going to impact the cost for your Parts B and D. So once you, based on how you file, anticipate what you're going to earn, complete this, we can now begin building out your plan to take a look at both your premiums and your out-of-pocket costs. The last thing, and then I will, oops, let me see, sorry about that, let me go back here. I guess I don't have a build for this, but at the bottom of the page it will ask you what parts of the Medicare cost would you like to see. Typically you'll check the first box. Unless you have coverage in retirement, you'll say show me the cost associated with A, B, D, supplemental and out-of-pocket related to my prescription. However, if you do retire with a supplemental plan or do retire with a prescription plan, you can check the box that says I don't need to see those, just show me my A and my B only, or my A, my B, and my D only. It allows this to really become specific to your specific situation. So now I will appropriately push, oh, there it is. I guess I skipped over it originally. I apologize. I thought it was there. So again, first box up top is for most people. The subsequent boxes would be based on what you do have. We don't want to overstate those costs by showing costs you don't need to see because you have the coverage from a private source. Okay. I will conclude my comments there. The summary is we know healthcare is expensive. We know it's hard to quantify. We have a tool to be able to help you do that. You have two basic choices. One will be original Medicare to pick and choose and control who you see and where you can go be seen, or you can use the Advantage plan, which may very well be more appropriate for you based on how and where you have your healthcare delivered. And then Nationwide has taken a leadership role on a very important topic, and we are able to put you in a proactive position to be able to plan appropriately when it comes to looking to quantify your expenses as they relate to quantifying your income needs in the future. So with that, I will pause there. I'll hand it back over to Tim to control for Q&A, and I will be glad to try to answer your questions.
Great, thank you. We have a few questions. I actually think I can bucket them. The first question I will answer, and that question was, will we get a recording of this? And the answer is yes. I will send out a recording probably tomorrow, if not Thursday at the latest, so that you'll have this information at your disposal. So that's question number one. Question number two is, a couple of people asked a very similar question, but I'm going to read one very specifically. And it says, my healthcare costs as an individual has gone up 15% per year. This year alone, it went up 26%. I figure that in 7 years, when I'm 64, before I get out, before I'll be eligible for Medicare, I will pay $2,000 a month for the right to healthcare. That's a mortgage payment. Who can afford that?
No, those are all. First of all, thank you for the commentary and the embedded question there. What I think is critical to understand is that there is definitely a difference in cost between healthcare in the private market, if you will, and healthcare to the public market. And what a lot of people do, especially those who are self-employed, have their own businesses, for buying healthcare in the private market, what they do realize is when it comes to cost, there's somewhat a sigh of relief, if you will, when it comes to enrolling in Medicare, because unless you are earning in the higher income brackets where you have higher premiums, you'll find the actual cost associated with Medicare will run lower than, in general, the cost of buying health care for yourself, for your family, for your business, for your employees. And so we see that all the time. But your observations from collectively, whoever the group is that brought those questions to the forefront, are correct. And at Nationwide, we spend a lot of time with our congressmen, with our senators, a lot of time at Capitol Hill. I spend a number of days there each year trying to help them understand what we're hearing from you. Not lobbyists in the truest fashion, but advocates, and letting them know that we really know that more needs to be done when it comes to what healthcare provides and what it costs. And so I appreciate your commentary. It's comments like that allow me to bring real boots on the ground feedback to our representatives, and hopefully can have some impact for you. So thank you.
Okay, the second question is, my birthday is on January 6th. Will I be able to choose open enrollment planning for a few days past January 1st?
Well, technically, if your birthday is January 6th, and I'm guessing maybe you're turning 55 on that day, is that correct? You would be eligible for coverage as of the first day of the month. So maybe we need to clarify that, but if we're talking about initial eligibility, our coverage, any time our coverage begins, for example, my birthday is the 20th of August, I would be able to apply 6 months prior to that, but my coverage would begin August 1st. So if that doesn't satisfy your question, please bring that back to Tim. I'll see if I can answer for you.
Okay. I think you answered this, but let's, for verification, for Medicare Part B, did you have individual prices listed, or were they per couple?
Yeah, great question again. And I know that there's so much here that we really need to emphasize it over and over again. Medicare is an individual policy. And so when you go back to the Part B premium schedule, that last column, the monthly costs were per person.
Great, thank you. So how can I save on these costs, or am I, I'm going to use the word he used, screwed?
The because B and D are predicated upon your modified adjusted gross income, the managing your modified adjusted gross income is really the only way to manage your cost out of pocket for those premiums. While I'm licensed, I do not work in the capacity of financial advisor, but there are some things you can do, not a lot, there are some things you can do to recategorize income. For example, if you have an IRA and you convert it to a Roth IRA, you will incur taxes in the year of that conversion because you're converting tax-free instruments to taxable. But from that point forward, the income generated from your Roth IRA will not be included in your MAGI. So again, right now I'm sitting in a hotel. It's not a Holiday Inn, but I want to just be very clear. I'm not your financial advisor, but I have stayed at a Holiday Inn. I just want you to know there are some ways to do that, but I would highly recommend that you would talk to your advisor, to Dave, who's on the call with us, whoever it is that's in better position, Dave, to help you understand. There are some ways, but they are limited. But the question is the cost to be able to do that worth the savings down the road? That's going to take someone that can take some time with you to help you understand that.
So this is David, and if I could answer that question as the licensed advisor on the call, and who's certainly available to work with any and everyone who has questions. If the question's referring to Social Security costs, then in terms of income tax planning strategies and deferrals, you want to work with me or with another advisor on how to structure your income in retirement so you have what you need but no more, and minimize your costs around your Medicare. If the cost is more referring to your individual health care while you're still working for that individual who was in their mid-50s, there are some strategies. That's a more specific question. I'd be delighted to chat with you one-on-one, but there are some abilities in terms of how you shop, the coverage you look at, and perhaps how you look at your assets as part of your insurance package to help reduce that premium, because certainly that was a very substantial premium. So I would be happy to to address that on a case-by-case basis.
Great, thank you. So we have time.
Tim, are there any other questions?
Yeah,
we hand it over to Dave.
We have a couple of more questions, and I think I know the answers, but I'm going to let you respond. During your conversation about Medicare Part D, you referenced Columbus, Ohio as kind of where you got the rates from. How much different is that than, say, a larger metropolitan area like Washington, D.C., New York City, et cetera? Or is that a tax advisor or financial advisor question?
No, it's an intuitively correct question, and what you'll find is, and if I can take us back there, bear with me for a moment. It's only a few slides prior to this here. Here we go. So if you take a look at this, we use it for the supplemental plans. I would say in the metro region, so anybody up, 70, 270, the Beltway, as we get into Northern Virginia, Southern Maryland, and so on, we're going to look at costs probably closer into the 200s and mid-200s as well. As we get into some of the major metropolitan areas, those costs can go up by as much as 20, 30, 40%.
Great. So we've received an explosion of questions all of a sudden. So I don't know if we had a little bit of a technical hiccup, but we're going to take one more question, and then I will send the list of questions over to Carlo and David, and have them answer them, and I will send that in a follow-up email so that you have answers to your questions as best you can. So the last question that we're going to have you answer tonight is, if you defer Social Security payments, sorry about that, how is the Medicare premium paid?
Great group, great questions. I appreciate that. You pay it directly on a quarterly basis. So ultimately, for those who are employing a deferral strategy for their Social Security, who have attained age 65 or older and are enrolled in their Part B, to clarify for the rest of the participants, if you are not enrolled in Social Security but you are enrolled in Medicare, you will pay for your Part B premiums directly on a quarterly basis. Once you do enroll in Social Security, at that point going forward, your benefit will be reduced by the commensurate amount, and whatever is deposited directly in your account will be a reflection of that amount.
Great, thank you. So with that being said, I'm going to turn this over to David to round out the webinar. And again, I will be sending out an email with the link to the presentation tomorrow or possibly Thursday. And then once I get answers to the additional questions that have come through here at the last minute, I will send those out in a separate email so that you'll have those questions answered for you. So with that being said, David, I'll turn it over to you and then we'll close out.
Okay, wonderful. Thanks, Tim. I neglected to mention my history with Maryland at the start of the seminar. I would just state that I graduated from the Smith School of Business in 2003, and my phone just flashed at me that the Terps basketball team beat Bowie State by 31 points tonight, so I thought everyone would want to know that. In following up with me personally, my contact information will be distributed by Tim. Additionally, if you have questions that you want Carlo and I to get started on, email is the best way to start with that. It is my last name, Arnold, A-R-N-O-L-D, another D for David, and the number 3. ArnoldD3@nationwide.com. The best thing you can do in terms of making sense of all this, I know there's a lot of numbers and a lot of uncertainty with it, is that fact finder is going to be distributed through Tim's follow-up email. Get that over to me. There's no cost, no obligation. We'll get you the information, and then you can work with me on explaining it. You can work with your local financial advisor. You can work with both of us. We're delighted to help you out. So we'll get that information out to you. All the additional questions Tim has, we'll get those answered in the next couple of days very quickly, and you'll have my contact information as well for a personal follow-up. Thank you so much for attending. We really appreciate it. Go Terps.
Good night, everyone.
Night.